Hello everyone, I'm Tarana Ali and I'll be presenting on a topic that is anorexia nervosa. Before learning deep about this eating disorder, let me define what is anorexia nervosa. Anorexia nervosa is a life threatening eating disorder. It is defined as self starvation in order to maintain an abnormally low body weight. Low body weight is described as weighing less than the minimum that is considered normal for the person's age, sex, stages of growth and development, and physical health. Individuals with anorexia nervosa have an intense fear of gaining weight or becoming fat and have a distorted self image of their body weight and shape. They also eat low calorie food, do excessive amount of exercise, always distracted and unable to concentrate due to starvation. The term anorexia is derived from Greek origin which literally means nervous absence of appetite or loss of appetite. As there is less intake of nutrients in the body, this lack of nutrients may lead to other physical signs and symptoms that includes severe loss of muscle mass, exhaustion, dizziness, hypothermia that is low blood temperature, cold hands and feet, upset stomach, dry skin, swollen hands and feet, hair loss of menstruation or less frequent periods, infertility, insomnia that is difficulty in sleeping, loss of bone density that may increase the risk of fractures, brittle nails, abnormal heart rhythm, lanugo that is fine hair on the body, bad breath, tooth decay, frequent vomiting. It may also demonstrate certain behaviors which are also a warning sign, such as limiting overall food intake or range of food consumed, showing excessive concern with weight, body size, dieting, calories, and food, assessing body weight and size frequently, complaining about being fat or overweight, denying hunger or avoiding meal times, eating food in specific order, withdrawal from friends and family because they may feel that they'll be tempted to eat while seeing their family members and friends eating and showing signs of depression. Now, there are some factors that may cause to increase a risk like being criticized about eating habits, weight or body shape and being teased or bullied, especially about weight or body shape in the past experiences. A sense of pressure from society or profession like media, magazines, social media, especially the models are influenced as they feel pressurized to be in perfect shape to look good. They also have low self esteem, anxiety, having a personality that tends towards obsession or perfectionism, having a history of dieting, pressure to fit in cultural norms which are not their own. Anorexia nervosa may develop due to genetic factors like close family members such as parents or siblings having eating disorder and obsessive compulsive personality traits where people are trying to be perfect but easily being irritated due to weight gain. Under types of anorexia nervosa, there are two subgroups. First one is restrictive type, where there is severe limit in intake of food and doing excessive exercises. Second one is binge and purge subtype, eating large amount of food in a brief period of time, then intentionally vomiting or taking laxatives or even fasting. Starvation and being malnourished affects barely every system of the body like effects on the heart. It slows heart rate. There is low blood pressure and orthostatic hypotension. It is a form of low blood pressure that happens when you stand up from sitting or lying down. The heart itself can lose some of its muscle mass, which can lead to mitral valve prolapse. It is a condition in which one of the heart valves buckles backward on closing. It can cause heart arrhythmias, dizziness, and chest pain. Effects on the brain. Starvation affects brain structure, including decreased brain tissue and brain functioning like decision making, ability to focus, emotional control, appetite, regulation, and mood. It also leads to shrinkage in brain's gray matter. Effects on digestive tract. Starvation can cause abdominal discomfort and pain such as bloating, constipation, feeling of being full, as well as lead to fatty liver disease. Effects on body hormones. Starvation can cause missed menstrual periods and reduced level of hormones, low testosterone levels, delayed puberty, and physical growth, underactive thyroid, euthyroid 6 syndrome. It is a state where the thyroid gland is functioning normally but the thyroid hormones are at abnormal levels. And in older individuals, there is a risk of having weak bone loss, and stress fractures. It also causes infections, dry, rough, and yellow tinged skin, decreased urination, high cholesterol level, or may even lead to death. How to live with anorexic patient. The following tips is given by Maria Rego, the president of National Association of Anorexia Nervosa and Associated Disorders, for anyone who think that they or their loved ones may have anorexia. First is being kind and respectful rather than judgmental. Look into providers or treatment to find good matches and meet with some of the people to decide who can best help. Consider a treatment team including a dietitian, a therapist, and a psychiatrist, also of whom should be specialized in eating disorder. All of whom should be specialized in eating disorder. Make sure to get and give all the education and support possible. Review the treatment plan and make changes which will be best for oneself and their loved ones. There are some do's and don'ts, like instead of commenting on a person's weight or appearance, getting frustrated or annoyed by the eating habits, forcing to eat, or even trying to guilt trip, try to encourage friends and family member to seek professional help. It may be a difficult process, but reassuring that professional help is the most effective way to treat disorder. Showing compassion and care and listening without any judgment. Reiterate that eating disorder can be treated successfully and being patient enough cause eating disorders can't be resolved overnight. So encouraging to try again after several failure and keeping an aim for recovery can help them to have a positive thought because they are already going through low self-esteem which later might make them to withdraw from taking any treatment. Kinds of people who are at risk. Anorexia were sorry, Anorexia were more common in females than males, but rates of males are also increasing rapidly. The risk is greater in actors and actresses, models, dancers, athletes in sports such as wrestling, boxing, gymnastics, and figure skating, where appearance and weight is more important. This disorder can also be seen in teenagers, middle and upper socioeconomic group, mother with postpartum depression, victims of child abuse. Women between 12 to 25 years of age are more likely to have this disorder. People with anorexia tend to be very high achievers, perform well in academic, sports, work, and other activities. They tend to be perfectionists with obsessive anxious or depressive symptoms. It begins around the time of puberty, but it can develop at any point of time. Now, there are different ways to diagnose anorexic patients. First is physical exam. This may include measuring height and weight, checking vital signs such as heart rate, blood pressure and temperature, checking skin, nails, listening to heart and lungs, and examining abdomen. Second is lab test. It may include a complete blood count and more specialized blood tests to check electrolytes and protein as well as functioning of liver, kidney and thyroid. Also urinalysis may also be done. Third is psychological evaluation. A doctor or mental health professional will ask about thoughts, feelings, and eating habits. They may also ask to complete psychological self assessment questionnaires. Other studies, such as X rays, may be taken to check broken bones, check for pneumonia, or heart irregularities. Treatments for anorexia is generally done using a team approach which includes doctors, mental health professionals, dietitians. Some of the treatments for anorexic patients are storing a healthy weight. Getting back to a healthy weight is the first goal of treatment. Now, how can you do it? Is by going to primary care doctor who can provide medical care and supervise calorie needs and weight gain, hospitalization and other programs. If life is at risk, then treatment in a hospital emergency room is needed for issues like disturbance in heart rhythm, dehydration, and so on. Some clinics specialize in treating people by offering day programs or residential programs. Medical care. Because of the complication, anorexic patients may require frequent monitoring of vital signs, hydration level, and electrolytes as well as physical conditions. They may also require nasogastric tube for feeding. Psychotherapy is of two types. First type is family based. This is the only evidence based treatment for teenagers with anorexia because teenagers are unable to make good choices about eating and health while being in the grips of serious conditions. So, parents help their child until they can make good choices about health. Second type is individual therapy. For adults, cognitive behavioral therapy, specifically enhanced cognitive behavioral therapy, has been shown to help. The main goal is to normalize eating patterns and behaviors to support weight gain. The second goal is to help change distorted beliefs and thoughts that maintain restrictive eating. No medications are approved to treat anorexia because none has been found to work. However, antidepressants or other psychiatric medications can help treat other mental disorders. One of the biggest challenges in treating anorexia is that people may not want treatment. Some of the barriers to treatment may include thinking that one doesn't need treatment, fearing of weight gain, not seeing anorexia as an illness but rather a lifestyle choice. Anorexia Anorexia can be detected at early by getting educated. Start by learning about anorexia, especially the differences between the myths and facts. Talking and discussing the worries. Don't wait until symptoms become more severe. Getting medical help. Encourage oneself or close ones to see a primary care doctor or a psychiatrist. Uh, Giving support. People with anorexia often have a hard time trusting others. Praising and giving compliments, building a support network, being a role model, eating and exercising in positive ways so that others can perceive and practice in the same positive way. Some of the lifestyle and home remedies are sticking to the treatment plan, not skipping therapy sessions or straying from meal plans. talking to the doctor about appropriate vitamins and mineral supplements, not isolating from caring family members and friends who understand and are ready to help, resisting urges to weigh or checking in the mirror frequently. It may only fuel to maintain unhealthy habits. In conclusion, I would like to say that anorexia or any other disorder can be treated only if that particular person is willing to help itself, and also with the help of family, friends, and professionals who are good at examining eating disorder. So that's it, and here are my some references. That's it. Thank you.